So, coming to the next section of diabetes, we'll be talking about the etiological factors. What are the causating factors of diabetes, specifically diabetes type 1, type 2? So, we'll be talking about that in detail. So, now if we talk about specifically type 1 diabetes mellitus, there are a list of factors that can cause diabetes mellitus in an individual. We'll be talking about them. One being hereditary. As you all know, that hereditary has one of the most important reasons why a patient might be having diabetes mellitus. So, any individual having any genetic predisposition and a patient is prone to having genes that codes diabetes mellitus, then a patient could have diabetes mellitus type 1. So that is the reason why that this sort of diabetes mellitus is very common in children, as they already have those genes and it's usually transferred from their parents or their grandparents, and ultimately they also develop diabetes type 1. Autoimmune, like I've mentioned before, that the destruction of the pancreatic beta cells is because of an autoimmune disorder. So this specifically targets type 1 diabetes mellitus, and specifically a patient having type 1 diabetes mellitus, he also usually have other autoimmune disorders such as any thyroid disorder or any other endocrine adrenal gland insufficiency. So there are a list of autoimmune disorders that a patient might also develop. Viruses are also one of the reasons why a patient might have diabetes type 1. These viruses include Coxsackie virus, and they also could have mumps virus, and also cytomegalovirus is also one of the reasons why a patient might have type 1 diabetes mellitus. Autoimmune destruction of beta cells, like I've mentioned before, that this specific type 1 diabetes mellitus is because of the reason that the pancreatic beta cells are destroyed because of an autoimmune disorder, secondary to an autoimmune disorder, and ultimately they do not secrete any any insulin, and that is the reason why a patient has type 1 diabetes mellitus. Damage of the pancreas, it could be because of a lot of reasons, such as any trauma to the pancreas. A patient could have any infection that has destroyed the pancreas, or any sort of cancer that included pancreas, and then ultimately the decision of removing pancreas completely, and thus a patient might not be able to secrete any insulin. There are a lot of different environmental factors and drugs and toxins, and ultimately endocrine disease. So if a patient has any other sort of endocrine disease, this could also be the reason why a patient might develop type 1 diabetes mellitus. Now, if we talk about specifically the etiological factors regarding type 2 diabetes mellitus, they're a little different from type 1. It does not include any hereditary reason, any genetic factors, but it includes mostly environmental factors. So, first being high blood pressure. As you all know, that high blood pressure can predispose a patient to developing diabetes mellitus, but being more specific, the type 2 diabetes mellitus. Pancreatic disease, any sort of pancreatic disease can cause the patient to secrete insulin, but that insulin will not be recognized by the cells, and insulin resistance could develop. Obesity, as you all know, obesity is the mother of most of the diseases. So as you all know, that obesity can also develop heart diseases, cardiovascular diseases, atherosclerosis, and ultimately type 2 diabetes mellitus is also one of the causative factor. As you all know, that diabetes type 2 is usually in patients who are much older, and type 1 is in patients who are younger and who are teenagers. So as a patient keeps growing older, he is more prone to having type 2 diabetes mellitus. Genetic predisposition has a very low factor as compared to type 1 diabetes mellitus, which is one of the reasons why a patient might present with type 1. But there is, if a patient has family history of type 2 diabetes mellitus, it can be possible that he would also develop one. Any sort of stress, unhealthy food, which could lead to obesity and then ultimately lead to type 2 diabetes mellitus, and specifically sedentary lifestyle and some medicines. If we talk about a patient being very, very lazy and being obese and not having any sort of exercise in his daily routine, this could be one of the reasons that a patient could develop diabetes type 2. And if we talk about medicines, there are some specific medicines that could lead to this disease. It includes corticosteroids and some sort of diuretics, which specifically could be thiazide diuretics, and some beta blockers, and specifically statins have also proven to predispose a patient towards type 2 diabetes mellitus.